words of that last song, It's All About You, Jesus. And in combination with that, all along the time that I've spent in school, I've been thinking about the words of Jesus. It's in Matthew, I can't tell you where right now, dealing with the sheep and the goats, and the people ask him, well, when did we feed you? When did we clothe you? When did we shelter you? And he tells them, what you've done for the least of these, you've done for me. More troubling to me is the other passage when the people say, well, when didn't we feed you? When didn't we clothe you? When didn't we shelter you? And Jesus says, well, what you didn't do for the least of these, you haven't done for me. And that really kind of drives me, along with it's all about you, when I'm working on these messages, because quite frankly, healthcare is a very complex field, very convoluted, and it's difficult to try to get some of the points across. And what I've been talking about just barely scratches the surface. Just barely scratches the surface. On healthcare, in the master's degree program, I probably spent close to about 1,000 hours between classes and research and reading the research and trying to make sense of all of the articles that I have read. But on Friday, and Ted can probably tell you this, the air kind of turned blue around my house. About 3 o'clock in the afternoon. And I probably can't repeat anything of the things that I said. But I'm very frustrated. I'm very angry. Both my daughter and I have been beating our heads against the system that we call healthcare. And on top of healthcare, on Friday, she called to find out where her temporary disability check is. A lot of people that work for employers have this accident and disability policy that they don't think that they'll ever need. Well, insurance companies are your friends when you're paying premiums. They're not when they're trying to pay out when they owe you. She called to find out where her check was, and they said, well, you didn't send this form in. Well, she's been proactive. I've been the one faxing the forms. I write on the form date, time, and place that it was faxed from. There was a form faxed at the beginning of September. One came in the mail maybe about a week later. She called down there to find out if they needed that form because we had already faxed it in. And by the way, when you call customer service for this particular benefit provider, their call centers are overseas, so you have a communication barrier. She was told that form wasn't needed. They had everything to send out the check. She didn't get the check, and on Friday afternoon, she called to find out, and they said, well, you didn't send in the right form. She said, I talked to somebody a week ago. Needless to say, they needed that other form that the other person had told her that she didn't need to send in. She signed it. I ran to Beloit, faxed it. But also, the FMLA, which is Family Medical Leave Act, that's also been messed up. That's how you extend your health insurance. She got a statement from them. She paid money through the employer for the month of August. The benefit company is billing her for half of the month of August. The money that got sent in, we don't know where it went, because now they've set up 2 different accounts for her. Well, I think all of the money that she sent in for the premium, they applied to an account that they set up entirely for vision. They're billing her for half the month of August plus September. One account says she owes $1,400, the other account says $700. So not only, if anybody ever is injured and has to fall under FMLA, you not only have the stresses from trying to heal, stresses from the injury, you have the stresses put on you. And I'm going to make the statement from the insurance company rules and regulations. Oh, I didn't have my mic on.
Oh, that helps.
Can you hear me now?
Sorry about that. Didn't want to interrupt your story.
So, today I was going to start out a little bit about the safety net. And all of us are creatures, or our opinions are based real heavily on our experience. And experience covers a lot of things. Experience covers our parents, the community we lived in, whether or not it was rural, or whether it's brought up in the city. It covers our education. So our experiences strongly shape our lens or our worldview. And on the safety net, you hear a lot about that out in the public realm. And it's not my position to make any statement about who's right or who's wrong, but rather to relate what my experience with the safety net has been. To me, the safety net in the beginning was basically a black hole. It wasn't there. I had insurance, but I couldn't afford the maximum out of pocket to get my hip replaced. So I lived with pain for about 4 years, and many of you remember how I used to walk. I had a real exaggerated limp. Now I started thinking, perhaps that I've been able to take care of the hip, because the hip limited my mobility. Perhaps I wouldn't have fallen, and then I had to have surgery on the ankle with a plate and 7 screws and repair the rotator cuff in my shoulder. So had I had the hip done, all of that other surgery may not have had been done. Some of that is adding to the cost of healthcare in America. So I was underinsured. Then I went to uninsured after all of the medical stuff got done. I had a follow-up exam after I was uninsured. The bill was $740. Now, a little bit of the safety net kicked in at that point in time because I qualified for care in the community, because those are programs that facilities have that will give you help in paying your bills if you're uninsured. Nikki doesn't qualify for any care in community because she is underinsured. I didn't qualify for Medicaid. She doesn't qualify for Medicaid. I didn't qualify for Medicare because the only reason I was looking is because I couldn't afford the coverage that I had. That's why I had to drop it. Medicare doesn't accept that. That's not one of the qualifiers for being able to get Medicare. Currently, Medicare has a waiting list, so there's no help available there for my daughter. So that's been my experience of the safety net. She is eligible for HERS, but HERS has a 6-month, that's a risk-sharing pool in the state of Wisconsin, that people can go to get insurance that can't get it on the private market. But there's a 6-month pre-existing conditions. She could get on the policy, but then you have to wait 6 months to be treated for a condition that you're currently being treated for. So you're basically, if you've got something wrong with you, you go 6 months without care. Plus HERS does not have a drug fund. Now, my daughter is on numerous drugs. So now you have to go out and look at what's available on the market to try and lower the cost of the drugs, because the COBRA policy is too expensive to carry beyond November because her temporary disability policy ends then. If you're getting confused, I am trying to illustrate complexity. As Americans, we love complexity. I have story after story. I know someone that was supposed to have an MRI, $3,000, uninsured, not eligible for Medicaid. I know of another person that was supposed to have a colonoscopy, $5,000. The doctor won't do anything else until he has the colonoscopy done. Uninsured, can't afford it. That's another area. These preventative medicine test sometimes will prevent a much more expensive problem down the road. Now, had that person quoted the price on the colonoscopy, had insurance, the insurance company probably would pay the provider somewhere in the neighborhood of $1,000 to $1,500, because that's the discount that insurers negotiate with the provider. But if you don't have insurance, you got to pay full boat. Then if you don't, you face the collection agencies, and if the collection agencies don't get it, you go to court, you get a judgment against your wages or whatever else you have, and that's the environment in which a lot of people face when they're trying to heal. Last week we talked about. Can everybody read that? Can you see that fairly well? We talked about spending in America, what we spend on healthcare. On the left side of the chart, the line that's going through the rope is what we spend on healthcare in America. And you can see if you go across, it's about $8,000. The next one down is Canada, and you can see it. I think it's crossing what the lost it. Just crossing the $4,000 line. Last week I held up an article about the waste in healthcare, and they said 30 cents on the dollar was being wasted. Now, if you take 8,000 times 30 cents, you come up with $2,400. You subtract that from 8,000, and you come up with $5,600. So even if we eliminated the waste, we'd still be spending more than the other countries, and we're still rated 37th by World Health Organization in what happens to people in their medical care. The right-hand side of the chart shows how much we're spending as a percent of all the goods and services that are the value of all the goods and services produced in America. It's called the gross domestic product. You can see that we're spending considerably more than what the other countries do that are providing better health care for their people on an overall basis. I don't want to sound entirely negative on America, because there are some things that we do well in America. I said that last week. Cardiovascular disease, some of the patient self-management, we rank right up there. But on an overall basis, we rank 37. Last week we talked a little bit about the way of Jesus, and whether or not each one of us considers our experience with the healthcare system to taste like Jesus or not. And I talked a little bit about challenging unjust systems, and I believe I remember reading that many of the Christians in the early church were not killed because they were Christian. They were martyred because they were challenging systems. So when a person challenges systems, there can be a cost, because challenging the status quo can get you in a little bit of trouble.
So wait, you say they were martyred because they challenged the system, but they challenged the system because they were Christians.
Okay. Did everybody catch that? They challenged the system because they were Christian, but they weren't martyred because they were Christian. They were martyred